One thing we talk about a lot as an organization is the first question that a patient asks when they're being admitted into the hospital is, when can I go home? We have the ability to help enable that.
Prior to my son, I was very healthy. After I had him, I was diagnosed with a rare disease called, scleroderma. I now have to take a long-term medication in order for me to sustain life. What drew me to Option Care specifically was that I never knew that you can get this kind of therapy done in like a home setting or even in an infusion suite outside of it being in the hospital.
For somebody that came from a hospital setting, there's great joy in working for Option Care. It's that one-on-one. Just when she just comes and opens the door and smiles, and her nickname for me is Nene. She's just not my patient, she's like my family. I always say she's like my seventh niece.
It takes a lot of pieces and parts to get a patient home. My team, we speak with patients, families, case managers, social workers, other folks within the hospitals that manage referrals to show them what Option Care can do and that services that we offer.
I work in the intake department, so we act as liaisons between the sales team members and the pharmacists. It's very important to onboard the patients with proper documentation, verifying insurances, and making sure that our pharmacists, who we work directly with, have everything that they're needing.
So I'm in charge of all regulatory compliance for the clean room as well as all the technician staff. We are compounding medications all day. Medications are going in and out of the room constantly. We do take pride in what we do because at the end we are servicing a patient, and if we don't have appropriate technique, then the medication would have to be remade.
As soon as compounding is done, it seems like the job has just begun because pharmacists make sure that everything is correct, and then they send it through the pass-through refrigerators, which ends up in our hands where we do the final checks. We actually package up everything, and then it ends up in the courier's hands to end up in the patient. It's a pretty quick, efficient process. It's just a lot of pressure to make sure that you actually do your job correctly because at the end of the day, we're here for the patients.
Have you ever had a loved one that was in a hospital and that was really bad off? Just imagine someone coming into her room and handing her a piece of paper saying, this is how much you owe, and we need that payment right now. We step in and we do all of that. We deal with the insurance company on their behalf. They already got enough on their plate.
We talk a lot about providing extraordinary care that changes lives. And across the enterprise, whether they were clinicians that were laying hands on patients or our team members that were behind the scenes, when you think of the pinwheel that's behind me, those are the pieces that fit together. We have an opportunity to change lives for the better. And it's really an amazing organization, and it's really an incredible opportunity that we have every day.